Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by VillageMD, primary care physicians, practice medicine the way you've always wanted, data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel of VillageMD. Today, I'm so happy to welcome back Janessa Nelson. Our listeners know Janessa. She's our executive producer of Working Smarter and our legal operations analyst. Janessa, welcome.
Hi, thank you for having me again. As you can see, I have a new outfit for this episode.
Yes, it's a little puzzling.
Well, I mean, when you hear surprise, you think happy. But then when you hear billing, you think sad. So we're trying to show that dichotomy.
It is kind of a oxymoron, and it's a huge problem. So we're going to talk about today we've all been hearing about this, but we're going to give you some details about these new federal laws around surprise billing.
So Wendy, maybe we should start for the listeners. How did we get here? Why are these new regulations popping up?
Well, thank you for the question. It's a good question. So this has been a problem for a long time, but this particular regulation was really sparked by a report that was published in 2016 by some researchers at Yale, and they really did a deep study of some practices of emergency medicine providers. And that report was widely reviewed and got a lot of traction. And it was basically concluding that they're driving up through out-of-network charges, they're driving up the cost of healthcare, sometimes 80% and more. As a result of that, the government issued a GAO study that had a similar focus, but they really focused on air ambulance providers. And so that spurred a need for change, and that's led us to this new prohibition on surprise bills.
So what kinds of surprises do patients typically see when they're getting these bills?
Okay, so the concept is if you're in an emergency situation and you have a provider that's out of network across the street, you can still go there. Or, this GAO report talked about all of these, terrible bills that people were getting from air ambulances. And so obviously you can't control that. And so the concept is to get to those. That's what the surprise component of the rule refers to.
Yeah. And I mean, patients don't really have a choice when they're in who picks them up in the ambulance, what facility they go to. So it makes complete sense.
That makes sense. Right.
I mean, let's remind our listeners that we're seeing a lot of transparency work being done and new regulations that have been popping up for the last year or so.
This has been a hot topic for a long time, and we have a whole bunch of laws trying to get to it. But this year, we've seen some of the biggest sweeping changes in the area of price transparency, which includes hospital discounts. Then we have this surprise billing, and we're looking for a payer transparency rule that's going to be effective next year. So we are seeing a sweeping amount of change in the concept of price, fairness, and transparency.
Yeah, so people can expect all of these are sort of being grouped together, right?
Yes.
I mean, my initial thought when hearing about this with the surprise billing changes is, isn't this already illegal, Wendy?
And the answer is sort of. I mean, just in looking at this rule, it's so complicated because many states have some prohibitions, and the problem with state regulation is that it doesn't apply to health plans that are self-insured, and it may not apply always to every certain person's type of coverage. And so this is what we're seeing here with the surprise billing rule is two changes. One, they're trying hard to make it comprehensive, and so they're issuing regulations in connection with the Department of Treasury, the Department of Labor, so that they're trying to cover all types of plans. And they're taking existing law and driving it farther, so that there are some provisions in state laws that give exceptions or give the they create these this concept that the doctor can then negotiate with you or arbitrate with you, and it's very confusing and difficult to manage. So people end up just getting the bills anyway, and so it's trying to get to those exceptions and some of the grandfathering and some of the patchwork of and gaps and holes in the existing laws.
Great. Yeah, that's a great primer. So not only is it sort of getting rid of exceptions from grandfathering, but what else is this new law doing?
Okay, so the first thing to know is that this is going to come out in phases. So we have the No Surprise Act, then we're going to have some transparency rules that are going to give you, we don't know yet, but some ability to make price comparisons. And then there's going to be some future rulemaking, we're told, about provisions specifically for air ambulance, as well as some rate negotiations and provisions that affect agents and brokers and some other kinds of short-term health coverage. So we're going to see this come out in phases. And it's worth noting that many times we go over regulations here. Our goal is to give you a summary, and we always say, you know, these are complicated, but this is very dense and complicated. And so it's gonna flesh out more over the series of phases. This is just an interim final rule. We're gonna see more change here. So we don't know all of the details yet, but what we know is that this is going to be a change for these three kinds of providers that we've covered. So we know the rule is effective this month. And we also just got the penalties, which are $10,000 per violation.
So if they can't bill you what they were going to bill you, what can they bill you now?
That is the question. And this is where it gets really complicated. And so the way this rule works is it's layering. It's saying and it depends on the state you're in, and it depends on the program you're in. But so if you're in a program that already has provisions for this, then you follow those. If you're in a state that has provisions, you follow that. But if not, then they've created this concept of the median price. And just suffice it to say that is going to be complicated, because what is a median price? Who knows? And as a consumer, how do you even know you got the median price? So there's a lot of things to be worked out. And that's why we think we're going to get another rule that sorts out some of that even in further detail. But the concept is they're going to give you a blended sort of discountish price if you're out of network. We know the rule is effective now. We know that we've just received word that the penalties are going to be steep, $10,000 per violation. But honestly, really getting this into effect is going to take time. So more than anything right now, we're going to have to watch how it shakes out. The most important thing for our listeners to know is this is here. It's going to continue to develop, but this is definitely going to be a good development in terms of the surprise billing for out-of-network providers.
Yeah, and Wendy, should our listeners be aware of anything else that's coming down the pipeline as well? I think that they mentioned that there's different phases, right?
Yeah, so we're going to see, thank you. We're going to see what they've told us in the rule, that this is phase one. Then the next phase is called transparency, and they're going to do some price comparators, which that'll be interesting. We have to see what that's going to include. And then after that, we're going to see more other rulemaking about that, how that rate is determined, and some dispute resolution around that rate, whatever that median rate would be, as well as some other provisions to do some monitoring of air ambulance rates and things like that. So we're going to see a number of waves of this come out. And interestingly, CMS just this month released its new sort of strategic plan, and health equity is really one of its top priorities. And so this, of course, is relevant to the surprise billing. We're going to see a lot of rulemaking over the next couple of years around equitable and fair billing.
Yeah, I mean, that's good to know. This sort of, in some ways, do you see this as a Band-Aid, or do you think that this is really comprehensive? Are you hoping for more after looking at this and reviewing
That's
it?
a good question. I think there are inherent difficulties with forcing providers and companies to bill a certain rate. It's just very hard. And our healthcare system is so fragmented, where you have state plans, federal plans, you have government plans. And so I think this is going to take us further but I think there will be gaps here until we get more clarity and more rules.
Yeah, I think that's helpful context. Thanks so much for walking us through this, and we'll keep everybody who listens up to date as we get more information and new laws come out. So
Yeah. Janessa, thanks for joining me to talk about this sad surprise.
Well, thank you for walking us through it. And just as an FYI to everybody, please make sure to like and follow us on any of our podcasting channels or on Vimeo. There is closed captioning on the video if that is something that you want. We also release a transcript as a part of our show notes. That's on our website. Thanks everyone for listening, and we can't wait to have you back another time.
Thank you to our sponsor, VillageMD. We hope you will join us for future concise compliance conversations.